Holly Cotton here, and you guys, I am so excited for today's show because one, I have our celebrity nurse that's going to be giving us some insight today on a bunch of topics. So, first, let me just let you guys know Miss Nurse Alex, excuse, Nurse Alice Benjamin is a nationally board certified clinical nurse specialist and family nurse practitioner with over 25 years experience. She has specialized in critical care, emergency medicine, cardiovascular health. So yeah, put some respect on her name. She knows exactly what she's talking about. She's also the chief nursing officer at nurse.org, which is the largest online nursing media outlet and NBC4 Los Angeles TV medical contributor. So, whew, that I know that wore me out saying that. So I know Nurse Alice, that's a lot that you have going on. So it's so nice to meet you. Thank you for coming in today and talking to us.
Thank you so much for having me. I'm really excited to jump into our conversation today.
Yes. So first, Nurse Alice, I know that we're going to talk about some other things, but the first thing that everyone, because people keep asking me as well as a nurse, is about this news break that has 7,600 fake nursing diplomas issued in Florida for whatever the reason is for. So first, like I told Nurse Alice before we started, I'm like, you know what? I don't know if I'm mad about this. I don't know if I'm mad that it's like a violation of people that are now practicing nursing that didn't have to go through it, or if I'm mad that I had to go through all the regimen and I could have been practicing under a fake diploma all this time. So Nurse Alice, like we said, you with all your background and all of the things that you do and all of the media that you participate and give your expert opinion in, what's your opinion on this situation with the fake nursing diplomas?
Oh my, okay, where do I start here? So I will say this, as someone who's been nearly 25 years in the profession, this is so disappointing to me to see this. I'll be honest, it's very disappointing, especially since nurses have just been voted for the 21st year in a row, the most trusted, the most ethical profession, um, for 21 years in a row. And then we see a story like this come like right on the tails of that. It can confuse the public. And we know that the public has already, especially during COVID, so much distrust has come out, even more so, right? Especially in communities of color. And so when you see a story like this, 7,600 fake diplomas. And of that, I believe there's only 3,200 of them have passed the boards and went on to become nurses. So let's look at that number. And there are over 4 million nurses in the United States. So even though we shouldn't see anything, it's still a very small number of people who are practicing, but it's very discouraging. But I think things that have been left out of the media coverage is that these were small private colleges, so they're not like your big universities or anything like that. And what's disheartening even more is that you had people who took the most trusted profession, the largest segment of the healthcare workforce, and for their own selfish reasons, tried to exploit it, and more so exploit the people of attendance who were predominantly South Florida's Haitian American community. So you take people of BIPOC community, people of lower socioeconomic background, and people who just want to kind of get in the workforce and to work. If these people charged and only used their positions to help recruit and funnel these people in the right way, we could have done so much more work. Instead, we're seeing these fake stories. People are running with it. The nursing profession is losing credibility. It's inserting a lot more distrust. And, I wish that wasn't the headline. And I want to see more stories bringing out the details of how this happened, what they actually did, because this should not be a blanket statement over all nurses. Like, did you go to school in Florida? Oh, you must be one of those nurses. That is not the case, guys. It's not the case. And we have a lot of, smart, well-intended nurses who went to school, licensed, who are doing their best to take care of you. So please, please, please do not use this story to just blanket all nurses and nursing schools as corrupt, because they're not. It's just we had some bad apples in the bunch, but what profession doesn't have it, you know?
Right.
But I'm so salty about this story. I really
Yeah.
I am.
Well, first of all, let me just let y'all know that I have my master's degree in nursing from an accredited university. I promise you guys, I had to serve my time. You see these two wrinkles and these gray hairs right here. This is all from nursing school trauma, from having to study for the boards and all of that.
Yes.
So
Yeah,
that
because nursing school is rigorous. It's rigorous and it's well. And let me just say this because people don't know. So with nursing schools, they must be approved by the Board of Registered Nursing. So every state has their board, which is basically overseen by the governor because the governor appoints people to the Board of Registered Nursing because it's meant to protect the public. And then you insert some nurses and nurse administrators, nurse educators on that board. And that board is supposed to oversee and approve programs. These are programs that says, hey, we want to teach nursing school. We want to prepare individuals to practice professionally and take care of the public. And the board, the BRN, sets criteria to ensure safe that graduates of these programs can be safe. And then there's further accreditation. So there are actually lots of layers in how to protect the public and make sure that nurse candidates are well prepared. But again, these were small universities who finagled the system, found a little loophole, finagled the system, and it's they're no longer in operation. So I'm hopeful that this isn't existent in other states, but I'm sure every state is now going to go through a rigorous review of all their programs. So
oh
I
yeah.
say that because I want the public to feel that all is not lost and that all of nursing is corrupt, because we're not.
Right, right. And I actually read some more about the article and researched some more about it or whatever. And they said that the nurses that were practicing they were like in New York, they had some in Texas, some that were in Los Angeles. So however they got their licensure or whatever, like they actually were practicing in other states, not just Florida. So it is kind of something that, like you said, it's only 3,200 that actually passed the NCLEX. But because I can tell you, even with my nursing class, probably half of them failed the NCLEX. I'm like, oh my gosh, you went to school for all this time and you still failed the NCLEX. So they definitely, the NCLEX ain't no joke. So
It's
they thought
not.
they agree, but they that was it.
Right. And I think even though these people also said, even though they went to school in Florida, because of how licensure works, usually you apply for your state. So even if they applied for their state, and I believe Florida is a compact state. So even though you went to school in Florida, you can take a board in another state, the reciprocity or licensure by endorsement. So if I take the NCLEX in Florida, I can apply to another state, and after my license be endorsed. But per this investigation, the FBI did say that it took all of the attendees and sent their names to each respective state. So each state knows that if this name comes across the table, red flag, this is not going to move forward. So the attendees who participated, their names were shared with all those boards. So hopefully no one else slips through the crack with this.
Right. So basically, y'all had a good run. I hope y'all made y'all money while y'all could, because it's over.
Yes, it's over.
Right, right. So, Nurse Alice, what I wanted to now kind of just get into, I wanted to start off kind of catching that point because I know everyone is like asking about that since that's like one of the top things right there. But now I just want to take a step back and I want to just talk about you because you have a very unique platform in everything that you're doing. So, can you tell us about how you went from just a regular nurse to verified Nurse Alice Benjamin? That's everyone wants to hear her expert opinion about things on.
Well, when people ask me that, I always think like I really had no intentions and didn't set out to do that. I was actually inspired to become a nurse because everyone has a personal story. So my dad, he actually died in the emergency room of a sudden cardiac arrest. And at that time, a small community hospital in the hood, he didn't get the services, attention, or even the preventative care that he needed. And I know that now, right? And so I was like, you know what? I'm gonna be the best cardiac nurse in the world. This is not gonna happen to anyone else, especially in our community of color. And I kind of set out on this charge to, especially around cardiovascular health, because we know that minority groups are severely impacted even more and have worse outcomes. So I set out to do this, and in doing this in practice, I did my my ministry, if you will, is to do a lot of community service. So I became an ambassador for the American Heart Association, later became a national spokesperson for them. And then that spilled out to me doing community presentations in churches and businesses, at school events, at PTA meetings, like you name it. I was talking about heart health. And I was doing a community event. It was with a church. And nobody wanted to get their blood pressure taken. So I was being engaging and, relating to the people, because there are certain things that I can say as a woman of color that maybe a white male physician can't say, because I can be playful, because I know the story. I know what we eat on Sundays after church. I know. So anyways, I was creative and fun, and somebody from the American Heart Association approached me and said, Alice, you know what? You seem real engaging. You were able to get everyone over here. They were informed. They were entertained. Would you mind going on to KJLH radio and talking about heart health? And so I did that, and then it went well. And then they're like, can you come back and talk about strokes? And so I started doing KJLH radio, which is a large radio station here in Los Angeles. And so American Heart was sending me there. And then the KJLH producers, whenever a story on health would come up, they would invite me back. And then I started blogging. Y'all, this is back in the day before all of this, before social media hit now. I was doing blogs, okay, with websites, and started doing this and recording myself. And then it just spilled out, and I started posting stuff on social media, or excuse me, on YouTube and other things. And next thing I know, as the producers at KJLH are moving around, it's a small network, producers talk, and then they say, oh, I know someone who can talk about health. And my name just kept coming up. And it spilled into different radio opportunities, and then television opportunities started coming my way. And I was no prepared, because I didn't study journalism or media. I just kind of fell into it and literally learned as I went. And then I started doing like local television. I started doing some national shows. I'll say my first show was American Live with Megyn Kelly on Fox News Live in the morning. I had no idea what I was walking into. No idea, not prepared. But because I was passionate about health, I just stayed true to what I knew and what I wanted the public to know. And after I started doing a couple things, I took some journalism courses, some reporter courses, because I also wanted to be, since I was toggling the fence between being a health expert and being now in media, I wanted to be prepared. It's like working in a hospital and just orienting to the unit that I'm on. I needed to know the lay of the land, the politics, how things are done. And so that kind of just spilt over, and I just kept at it and just talking about the things that I'm passionate about. And I swear I did not realize that I was going to end up where I am today, which is the medical contributor for NBC4 Los Angeles, which is the second largest market second to New York. And I'm just talking about things I'm passionate about as a nurse, things that I would want to tell my friends and families to better take care of themselves, and also to represent communities of colors, because the idiosyncrasies of healthcare that specifically impact us and impact us differently, those stories don't get told all the time unless it's Black History Month or something like that. And I needed those type of things to get out in the forefront. So that's my story. Like, sometimes I don't even know how I got here. I just like blinked and I'm here. But I've had a fun run, and I'll also say I've also been targeted because I'm a Black female on television. People felt like I wasn't. I don't know. It's these people that sometimes felt like I wasn't being representative of everyone. And I'm a human, right? Just like if we all bleed red blood, but there are certain things that are specific to African Americans, to people of color, that we need to talk about. It's the elephant in the room, but it never gets talked about. So it was finally getting the opportunity to tell these stories, and especially during COVID. I think during COVID, I did television literally every day, several times during the week, and it was really an opportunity to, one, represent women on television, represent communities of color on television, and tell the stories, because we all know that COVID really it let the world know how more so and reveal the disparities in healthcare. Why were Black and brown people dying of COVID more? And then it kind of allowed us to look at other things. And so it's just been a really great journey, being able to use my education and training. Again, I've been in nursing for over 25 years. I'm a family nurse practitioner. I work in the emergency room now. Prior to that, I was working as a clinical nurse specialist in critical care, specializing in cardiovascular health. So I've always worked in the areas where people are likely to die. So don't tell me that I don't know what I'm doing. I'm not just sitting in the office. I'm not just trying to be pretty for TV or anything like that. I'm literally telling you real HIPAA compliant, obviously, but sharing important stories from the bedside, from the front lines. And these are the things that reporters, they can have health beats and things like that. They can be very passionate, but there's something different about someone who who's actually taking care of people in these life or death situations, and who comes from a community and has firsthand experience with her father dying in the emergency room because of the disparities in healthcare and community outreach.
I, I love all of that, Nurse Alice. And I will tell you this, I say exactly what you're saying all the time. First of all, I'm not even gonna talk about the minority part. I'm just gonna talk from the woman part, because people are like, well, sometimes you sound like you're a feminist, or I feel like you're man bashing. And I'm like, first of all, when I'm talking, I'm not even talking to men, for men, or whatever. I am talking as a woman and my perspective and my point of view. Now, if you're sensitive to it because you have whatever's going on with you, that's not my problem. I don't need to address that. But I will tell you, as a woman, I am going to highlight women. I am
Mm-hmm.
going to support women. I am going to pull, especially a minority woman, because it's not easy. I don't care how much Holly Cotton stuff I have going on. When I walk in a room, if someone doesn't know me, I have to constantly be proving that I should have a spot in that room, that what I'm
Exactly.
saying is valid, that I'm smart, that I know what I'm talking about. So people just don't understand that. And like you said, whenever people are saying that, oh well, it's all she's talking about is black culture, all she's talking about is this. But yes, because there is an issue there is a disparity there, so there is a need. We need Nurse Alice to tell y'all to quit eating fried chicken, and and
Well, see, what I'm gonna tell you though, but all I'm gonna say, because some people will not give their fried chicken, so give up their fried chicken. But I would say is, well, take off the skin off of one of them, and then just have the other one. But because it's all about moderation, so I think that's one of the things that's helped me to be successful in people listening to implying is, people say, oh, well, cut out salt completely. You do too much salt. You can't just go from 0 to 100 just like that. People are going to fall short, or they'll do it for 4 days, but then after a week, it's just like people's New Year's resolution to lose weight. They go strong in January, come February they've fallen off. So it's about meeting people where they're at, because I know where we're at. I know sometimes the tightness or lack of resources. I know what you're working with. You're considering budget, resources in your community. If you live in a food desert, there's no 24-hour fitness or uh, Planet Fitness or 24-hour in your neighborhood, how you can exercise at home. So it's about meeting people where they're at to make being healthy realistic given their situations. Like in the nursing world, we would say like individualizing the care plan for your patient specific needs. So that's what I would take, those nursing concepts, and apply them to what I did in media, which also set me different from the other health journalists that were out there, or the doctors, which initially early in my career I would get trumped, like, oh, Nurse Alice, we know, you're very knowledgeable about cardiovascular health, but we're going to have this doctor go on. Well, who's the doctor? Oh, Dr. So-and-so, he's an OBGYN. Oh, you can have OBGYN talk about heart health too.
just because he's a
So doctor. So, but I will say the consistency in me continuing to always tell stories, and be willing and available, especially certain topics I'm just extremely passionate about, and always being available and kind of fun and engaging and realistic with it, I think was something that sets me different. Uh, and so I was able to then later trump the physician. So I've had a lot of physicians say like, well, why her? She's just a nurse. Excuse me, sir? Excuse me? No, we're all healthcare providers, and I think what people folks don't understand is, we can go to school and have a lot of credentials and training, and I probably, I have a lot of that too, but it's really about public interest, community health. And so I don't care if you got 500 letters behind your name, but if you can't translate the evidence, right? Translate it in a way that is digestible and usable for the consumer, then it does us no good. I'm not on TV to sound smart. I'm on TV to help educate and empower people to live healthier lives, to make better health decisions for themselves and their families and for the people that they surround themselves with. So that's something that I like to do, educate and empower people. Because you can spew out facts and to-do lists and things like that, but how do you empower someone, inspire someone to want to make the healthier choices given their situations? You got to, inspire people to uh, um, rise above any challenges or obstacles that are there. So those are things that I also like to insert in my messages when I'm talking to people about health.
Yeah, and I just wanted to piggyback on what you said too, because I'm also a college professor and I teach nursing. So I teach nursing and CNA students as well. And it's funny that you're saying, like, as I'm listening to you, I'm like, so when I'm talking to my nursing students, and I always make them explain it to me as like I was the patient, because I'm like, yeah, okay, yeah, pharmacology, whatever, but I'm a patient. I don't know that. And it's funny because that is a role that nurses have that we you don't even know in nursing school that your role is going to be the doctor's going to come in, talk a bunch of gibberish, and then the patient is going to go, okay, got it. And then as soon as you come in as the nurse, they're like, I didn't understand a word he said. What does this mean? So
Yep.
that it shows that that you definitely have that passion, because you have to do so much patient education that now that's also spilled over to what you're doing, because it came naturally for you because you've been educating patients all this time. So now it's
Mhm.
just like the world is your patient now, so you can just tell us all that
Yes.
stuff to us. So I love that. You
Right.
guys, I love Nurse
Thank you.
Alice doing
Thanks.
it. So, what I wanted to talk about next, like you said, cardiovascular health is something really big that you're obviously professional and passionate about. So, lucky for us, you guys, February is actually American Heart Month. And you're going to wear red, you're going to go red, do all of that red stuff for heart awareness. So, Nurse Alice, can you tell us about some of the common disparities, especially in the minority community, whenever you're talking about cardiovascular health?
Yes. So every year, nearly 700,000 people in the United States die of heart disease. And heart disease, for the most part, is largely preventable, meaning that if we can have apply some lifestyle changes with diet, exercises, smoking, drinking, stress management, other things, and blood pressure management, that we can largely prevent a lot of the outcomes, or at least delay them for a significant amount of time. And so, and it's the leading cause of death. It is a leading cause of death. And I think when we think about heart disease, someone will say, "Oh, I don't have heart disease. I just have high blood pressure." Well, high blood pressure will lead to heart disease if not properly managed. So many times I've seen people and I've said, "Okay, so I'll see a high blood pressure and I'll say, "So how's your blood pressure been?" "It's good." "Well, what's good? Give me some numbers." "I don't know. The doctor said it's good. The nurse just said it's good." And so this is one of those times where I'm trying to inspire people, empower them, but also ask them to have some accountability, and to actually ask their providers to say, "I know you said it's good, but what is that number?" People need to be informed. You can only change things if you're informed on them and know where
180
you
over
start.
100, and now today is 160 over 99.
Yes, exactly.
Doesn't mean it's good. That just means that, right.
Right. Good. The word good is relative, or it's better. That's relative to what it was before. But um, you know, so many people have high blood pressure, and I think that is one of the most important things. Blood pressure management, lifestyles, diet, and exercise activity levels that can prevent a lot of heart disease. But there's this, even though we know heart disease is the leading cause of death, there's even disparities in diseases, guys. And what people may not know is that women actually are often misdiagnosed or undiagnosed when it comes to heart disease, and things like heart attacks. And so, some people they get confused when I say that. They're like, "What do you mean? Men are the ones that always are the ones that put off going to the hospital. They don't like going to their doctors and things like that." And that women, we're the caretakers usually of the family and getting people to go to their appointments. However, what's when people have heart attacks or experience symptoms of them, everyone thinks like, I think of Sanford and Son. That's how old I am, all y'all. I don't know if y'all know that show.
The big
Oh,
one.
it's the big one. I'm coming home. Ethel, here I go. Like, that big chest pain, that tight squeezing. And while that is the most common symptom, some people when they have heart attacks don't even experience that at all, and that's mostly in women. Women don't always have that, oh my, significant chest pain. They have more vague symptoms like upset stomach, shoulder pain, back pain, those type of things. And I think that because we as women don't experience always that large, significant chest pain, we don't go to seek care right away. So in the emergency room, I will see women that come in and says, I just have this anxiety, this upset stomach, and this shoulder pain that just won't go away. And when you ask them how long you've been feeling this, oh, it's been 3 or 4 days. She's actually had a heart attack and not realize it because she's delayed going in. So that's one component of it. And something else I really want the community to know. It's something we have to address. I'm not necessarily proud of it because I work in the health profession, but there are a lot of health professionals that do gaslighting. Someone comes in, maybe a 40-year-old woman who says, oh, I'm having this chest pain. Oh, it must be indigestion. Well, hold up. You didn't even work me up. You didn't do an EKG. You didn't ask me, about my lifestyle or all these other things. Like the health provider has already stereotype what they think this is, so it delays their workup. And so if it is indeed a heart attack, either it gets missed and it gets sent home with some like Malox or something like that, or when we finally do work them up, they've already been in the ER for 7 hours before we've run a troponin or did an EKG. And usually in that point, it's someone who's persistent, like, no, something's wrong. I'm not going home yet. And you're like, fine, let's do an EKG and then we'll get her out of here when it's negative. Oh, shoot. EKG shows some waveform changes. Oh, her troponin levels elevated. Let's go ahead and admit her. But so there's this kind of medical gaslighting that happens in healthcare, and it happens in the hierarchy. There's a study that shows that people came in with this type of pain. White men were listened to the most, got care right away, followed by Black men, followed by white women, followed by Black women. So story is women are listened to the least or least believed when they're having this type of chest pain come in the emergency room. But if you want to be more specific, it's Black women who are less likely to be listened to. So I really empower people to, you're the patient, you're the boss. I know some providers will disagree with this, but the patient is your boss for that encounter, because without you, you wouldn't have any work. Now, I know there are other patients, but in this encounter, they're coming to you with a complaint, an issue. We have to do our due diligence and make sure we've checked off all the whole list of what could this be, and not just assume what it is. And I know we as healthcare providers, we kind of have these stereotypes in our head, not really meant for bad, meant for good, so it can expedite us getting to a diagnosis. But sometimes because of implicit bias and other things, it takes us down the wrong pathway. And because of that, patients don't get the medical workup that they need. So when I go back to my story about how my dad died of sudden cardiac arrest in the hospital, and that was even long, where racism was even more, I wouldn't say more, probably, it was probably the same prevalence, but there's definitely disparities in the quality of care. And so I believe, although I could just tell myself this story, that if he'd got the proper attention and treatment workup, even the outpatient education, that he could have had a different outcome than what he did that day.
Oh no, I totally agree. I think that too. I have a family member, and I remember being younger, and she died um, with childbirth, and they actually they realized that she had gestational diabetes, and that she like that nobody was even thinking that that's why her legs were swollen. They didn't think, like it was just all these things that I heard as an adult that had become a nurse. And when I was hearing the story about, and her legs were so big, and I'm like, so nobody knew she had high blood pressure, preeclampsia. Nobody
Right.
knew she had gestational diabetes, because they tried to save the baby, and the baby was like 10 pounds at like 30 weeks. So, I'm already thinking all of these things. But again, nobody thought about that stuff back then. They were just like, oh well, something was wrong. Or I'm from the South, so they're like, well, the Lord didn't, he was protecting her from what was going to be wrong with the baby. And I was like, well, no, she just probably had gestational diabetes. Like, but nobody thought to poke her finger or do those types of tests back then. They just were like, throw it down the river. So I'm happy that you brought that up. And just to reiterate what Nurse Alice said for you guys, because see, I'm taking notes, Nurse Alice. One, you need to have a proactive approach when you go to the doctor, and you need to be taking accountability, and you need to say, what was my blood pressure? So when that lady, and I do it myself, like I just went for a procedure and she took my blood pressure and she was like, oh, everything. I was like, what is it? Because
Yes.
So I was like,
you don't even get to see the blood pressure machine. It's faced a whole other direction. Hold on, let me see. What does the machine say?
Yes.
That's what you really.
And that's what she did. She was like, okay, it's good. And I was like, what is it? Like, what is, whatever. And then she was like, oh, it's 104 over. I was like, oh, okay. Yeah, that's good. Okay. But because her definition of good might be 128 or 130 or I don't know what. So make sure that you are writing those numbers down. I can't tell you how many times I even just as a practicing nurse, I don't anymore, but I would always be like, well, what was your last blood pressure? I don't know. And I'm like, okay, well, next time, write it down. So I love that. And also, Nurse Alice, can you one more time give us some stuff? Because, like I said, as women, I feel like I have this obligation to help all my fellow women. And I know for a fact 2 women just last year that died of heart attacks. Like one was, I think she was 50, and then one is like my age that I think I went to high school, graduated with her, or I went to high school, whatever. So she's like my age. And so y'all don't need to know how old I am. Just know she's my age. But so can you kind of just go down those symptoms one more time for women that are listening?
Right. So, again, we'll say that, having chest pain, that tightness around the chest, elephant on your chest, that is the most common symptom. However, not everyone has that. So other symptoms could be maybe you're feeling like an indigestion, maybe you're feeling some abdominal pain, some just upset stomach. You can have some pain, usually in the back between your shoulder blades, or maybe it radiates to like your left shoulder. Those, and maybe some anxiety. So those are very vague. Those can be a lot of things. You get me upset enough and I can feel those things. All right. My kids can really get on my nerves sometimes and I feel those things, but it's something that's important and you shouldn't dismiss subtle symptoms like that. And I know, especially as women, we got to, drop the kids off to school. We got a disappointment. We got to, the plumber's coming for this. Like we're so busy doing life things that we dismiss subtle symptoms thinking, oh, it'll go away in a while. It'll go away in a while. And the truth is, those are signs that we really need to pay attention to our body. Your body's talking to you. Your body's talking to you and it wants you to seek care or attention. If you think it is something that's, indigestion, take some Maalox right then and there. Okay, didn't go away. Well, then that gets you, that's further reinforcement for some people that, okay, something else is bothering me. Because I think people are worried about going to the emergency room and going there like, oh, this is silly. I'm just here for indigestion. All I needed was some Maalox.